Welcome to Kidney Cancer Unfiltered. I'm your host, Anna Maria Scaccia. Today, we're talking with Kate Zalewski, a dietitian who specializes in kidney health. Kate sets the record straight on common misconceptions about kidney diets and explains why it's so important to work with a nutrition professional who understands your specific needs. This episode is full of practical advice for anyone managing their diet with kidney cancer. Let's dive in. Well, Kate, thank you so much for joining me today to talk about diet and nutrition. For our listeners who may not be familiar with you, why don't you introduce yourself?
Yeah, thank you. So my name is Kate Zalewski. I am a registered dietitian and I am a board certified specialist in renal nutrition. So for the last 7, 8 years now, I've worked exclusively with people with kidney disease and other kidney related nutrition concerns. And there is just such a great need for a greater understanding of how nutrition connects to the kidneys, because it can play a really big
Yeah.
role in helping you to feel your best, and make sure that your kidney health is staying, in as good shape as possible.
Yeah. Well, thank you for joining us. I love chatting with you about renal nutrition because that is one thing that people often reach out to me about as a fitness and nutrition coach is, what do I eat? How do I eat for my kidney? And I think, there's a lot that information we have out there about nutrition during treatment, but there's not a lot of
Mm-hmm.
information out there really for people with one kidney who've gone through cancer after treatment in survivorship.
Mm-hmm.
So I know before we've talked in other places about misconceptions, but I think that's the one thing I love about talking about you is that you break down all those misconceptions in renal nutrition. So I'd love to start there. What are some of the myths that you hear often from your clients that you think just need to kind of go away?
Great question. I think that the very biggest misconception about nutrition for kidney health is that there is one right diet for kidney health. Like there's one right way to do it. If you search renal nutrition or renal diet on Google, oftentimes you will find all these lists of different types of foods to avoid. And a lot of the foods that you see on these lists are things like bananas, tomatoes, avocados, beans, whole grains. And rightfully, a lot of people find themselves thinking, wait a second, I thought these were the healthy things that I was
Yeah.
supposed to be having more of. So I'm supposed to avoid these things now. So that's, I think, one of the biggest issues is that there's, number one, a lot of outdated information online that is not aligned with our current kidney nutrition
Yeah.
guidelines. And number two, there's a greater, I think, recognition in recent years with our newer kidney nutrition guidelines, that there is a great degree of variability in nutrition depending on what's going on. If you have a solitary kidney after a nephrectomy, if you have kidney disease, if you have kidney stones, there's not one single right diet, because these are all distinct situations and each person is an individual. And a lot of what I do with my patients is, I look at labs, medications, symptoms, what's your health situation, and ultimately the diet that is best for, the patient that I'm working with can look very different from one person to the next. So broadly speaking, that's the biggest misconception, is that there's only one right way to do this, and it's this very restrictive diet that avoids all of these foods that you thought were healthy.
Yeah. So when clients come to you and say like, "Hey, I am having this issue with my diet and nutrition," or like, "I don't know where to go," um, what is the first thing you say to them? Like, what is the first thing you say to, I guess, maybe I don't want to say calm them down, might not be the right way to phrase it, but I think again, with the people who come to me, there's this frustration, there's this overwhelm, this is like fear of like, okay, I don't know what I'm doing. So I guess take me through like how you onboard a client when it comes to like just getting what they need right.
Mm-hmm. That's a good question. A lot of the people that come to the first meeting with me are very freaked out, anxious, not sure what to eat. My approach as a starting point is always uh, taking a step back and making sure, first of all, somebody understands how the kidneys work and how nutrition then affects the kidneys. I think this is important to understand because when you have an understanding of what's actually going on within the kidney and how it works and how different nutrients affect it, then you start to have a greater understanding and level of comfort with, okay, I can have these certain foods and they're going to have this type of effect. There's these other types of foods that maybe I should limit because this is how they're going to affect the kidney health. What the way I like to explain it when we're talking about like what the kidneys actually do is the kidneys, they filter, obviously, they
Hmm.
filter the blood, have a number of different functions, filter out toxins in the body. But when we think about what a kidney actually looks like, it's basically a dense network of a bunch of little blood vessels. There's a big renal artery that goes into the kidneys,
Hmm.
branches off into a bunch of little blood vessels and the filtering units. So when we're thinking about keeping, kidneys healthy, we're thinking about all those little blood vessels. How can we make sure that all those little vessels inside the kidneys are staying in good shape? There's not too much pressure on them. There's nothing causing damage to them. Once you have that, understanding of, oh, blood vessels, that kind of connects the kidneys to, I think, the whole body health
Hmm.
and how the kidneys relate to the cardiovascular system and the heart and the blood vessels. And I think that makes it easier to understand what types of things can affect the health of the kidneys. Because I think a lot of us have some understanding of what types of
Yeah.
things nutritionally might affect the blood vessels or the heart health. So I think linking that all together helps it to make more sense.
So what are some things that people who are starting their journey and having to maybe adjust their nutrition, what are some things they need to keep in mind first? Like even though there isn't like one set way to have
Mm-hmm.
to have a renal diet, what are just some things that they should keep in mind first when they're trying to navigate their own nutrition?
Good question. So the first thing I want to say is that just because you only have one kidney, it doesn't necessarily mean that you have decreased kidney function. The
Yeah.
kidneys are very resilient. You can lose up to like 30% of the functional units of the kidneys before they like labs start to look off. So some people are born with one kidney and are, perfectly healthy without one kidney. So just because you only have one kidney doesn't mean necessarily that function is decreased. And then you need to be looking at like a kidney disease type of diet. So I just want to emphasize that because I think those two things can kind of get conflated sometimes. Um, Going back to thinking about how the kidneys are made up of a bunch of blood vessels, though, one of the big things that we think about when we think about blood vessels and cardiovascular health is sodium and salt and keeping blood pressure controlled. Now, everyone has different, slightly different responses to salt in terms of how it
Yeah.
affects blood pressure. Some people might be more sodium sensitive. Other people maybe not so much. Some people can eat a really high salt diet and their blood pressure is fine. Lucky them.
Yeah.
Other people not so much. They might need to be more restricted. Um, if you know that you only have one kidney, I would suggest to be mindful of sodium, not necessarily to go overly restrictive and try to completely eliminate it because sodium is still a nutrient,
Yeah.
but it is something to definitely be mindful of. Something that's interesting about kidneys and blood pressure is that in some cases, if somebody has kidney disease, high blood pressure is something that can cause damage to the kidneys. So in that case, taking dietary steps to try to control the blood pressure is helpful. But one of the jobs of the kidneys is also to help regulate blood pressure. So we can also see difficulty in managing blood pressure result as a symptom down the
Hmm.
road of reduced kidney function. So it can both be a cause and a symptom. So just because it's the kidneys are blood vessels, the kidneys are involved in regulating blood pressure, I think it makes sense to be mindful of how much salt or sodium you're getting in your diet. The National Kidney Foundation recommends 2,300 milligrams of sodium per day or less. That's generally what I use as a starting point with my patients. But like I mentioned, it can be individualized. Some people need more, some people need less. And that's sometimes one of the things we have to kind of figure out as we go and ultimately settle into what's the right amount for you as an individual.
No, I'm glad you brought up the sodium part because I think for myself, rather, I know for myself, and I was thinking about this recently, that that is one area where I was like, okay, I need to lower my salt. Even though I actually have excellent blood pressure and it rarely is high. It was just one of those things where it's like, I need to lower my salt. And then I was talking to my son's doctor recently, my son's neurologist recently, and he was explaining that like with a lack of salt, and if you get up and you feel lightheaded, your blood pressure is probably so low. And I'm like, oh, I probably should not have taken that guidance to heart and like completely eliminated sodium. So yeah, so going back to the myth, and that's just like a random side story to tell you because it's just one of those
Mm-hmm.
things where I think about, I'm like, well, how have I approached my nutrition? Like, where are the
Mm-hmm.
places where I'm being overly cautious and not really considering what I need for my body? And so
Right.
that leads into and I think a lot that ties into labs. And like, if you don't know necessarily how to read your labs, or rather, you're looking at your labs as individual markers versus like the whole holistic picture, you may be like, okay, I need to be overly cautious here or there. So I think
Mm-hmm.
that's my next question. Like, I want to talk about how can people read their own labs, or if they don't have like the guidance of you, like a coach or anything.
Mm-hmm.
What are some things people should keep in mind about looking at their labs when they're trying to figure out their own nutrition?
Mm-hmm. Yeah, I think being able to understand your labs is super important. And like you were saying, we want to make sure that we are not being too restrictive on things because, salt, sodium, it is still a nutrient. Your body does need some. I have seen situations where people have restricted it way too much and gotten nauseous, lightheaded, dizzy, a low sodium level on the labs. So, some of the primary things that I look for on labs as a dietitian when I am working with my patients when it comes to the kidneys. The primary things that I look at, and probably what nephrologists would be looking at as well, on the either the basic metabolic panel or a comprehensive metabolic panel. The primary thing that we look at as an indicator of kidney function is the creatinine. Creatinine is a byproduct of muscle breakdown, which is normal. All the cells in our body are constantly breaking down, regenerating. There's all these metabolic processes going on, so
Mhm.
that's normal. And we can use this creatinine in the blood as kind of a proxy of how well the kidney function is working or how well the kidneys are filtering. Um, then that creatinine can be used in an equation to calculate something called the eGFR, or estimated glomerular filtration rate, which is essentially an estimate of what percent kidney function somebody has. Now, big caveat, and I know we've talked about this before
Yeah.
previously, is that creatinine is not necessarily a great marker or the most accurate way to measure kidney function. There's a lot of things that could be confounding factors with creatinine. Since it's a byproduct of muscle tissue turnover and breakdown, if you're somebody who has naturally more muscle, you're going to
Hmm.
have a higher baseline creatinine. That doesn't mean your kidney function is any worse. It just means you have a little bit more creatinine circulating in your body. The other thing that I see really frequently that can impact creatinine is hydration. If
Hmm.
you are dehydrated when you go to get your labs drawn, essentially it can make this creatinine come back on your labs a little like overly concentrated, essentially.
Yeah.
So it makes the creatinine look a little higher than it really is. And then when you put that into the equation to calculate GFR, it makes the GFR look lower than it
Hmm.
really is. So I'm not saying to go and chug water before you go get your labs drawn to try to make your numbers look good. But in general, you want to make sure that you are staying well hydrated. And this is in general for kidney health, one of the most important things you can do is stay well hydrated. But that can definitely be a factor when you get your labs drawn. I just had an appointment with a patient this week who, when they went to get their labs done recently, they were recovering from being sick. They hadn't
Mm.
been eating very much. They had been throwing up. I mean, that's a recipe to be dehydrated. If
Yep.
you're sick, throwing up, not eating, not drinking, And no surprise, the labs gave the appearance that there had been a drop in kidney function, but those are really major confounding factors that we wouldn't want to necessarily look at that one pinpoint in time to get a like accurate idea of like where kidney function is heading in general. So those are two big things to look at on the labs. The other thing that I look at is if there's any protein leaking into the urine. The kidneys make urine. That's what they
Yeah.
do. They filter the blood, and all the waste goes into the urine. And ideally, the urine should be clean. It should be clear. Shouldn't have blood or ketones or glucose or white blood cells or other things in the urine. So if there's stuff in the urine, that could be an indicator that there is an issue. So I think that having discussions with your healthcare team about, what's your baseline with some of these different things on your labs and what is your healthcare team's goal for you is important, because there might be specific numbers that your doctors want you to be aiming for. Just because something on the lab says it's high or low or out of range doesn't mean that it's necessarily out of range for you based on the numbers that your team has for you. So being able to look at your labs and understand what your healthcare team wants you to be achieving, that's really helpful, and you can in turn use some of those things on your labs to guide your nutrition plan.
And I'm glad that you brought up creatinine, because that is something that we talked about before, something that comes often with me and in my coaching, people coming to me particularly about protein. And so I think there's a lot, or rather I've noticed, I wonder if you notice it too, there's a lot of shifting guidance and ideas around protein intake in the kidneys. And one thing that I found
Mm-hmm.
really interesting that I've learned from you coming up is that, or that's coming out, is that it's not necessarily the amount of protein that you're intaking that impacts the kidneys as much as it actually is the quality and the type of protein
Mm-hmm.
that you're eating that can have an impact on your kidneys. So I'd love for you to break that down a little bit more into, what are some myths around protein and kidney function, and what is like the current guidance or thinking around protein intake to protect kidney health.
Mm-hmm. Lots of myths and misconceptions about protein. So I think that, just broadly speaking, if you hear protein is bad for the kidneys or protein hurts the kidneys, there's a lot more nuance than that. And first of all, everyone needs protein. Our bodies
Yes.
need protein. And I have seen people, again, read protein is bad or it hurts the kidneys and try to completely cut those foods out of your diet. We do not want to do that. You need to have protein. Your body needs it. Very important. If you are eating large amounts of certain types of protein, it could be more burdensome on the kidneys. And what you mean when you're talking about, quality and different types of protein, what we're really seeing a lot of discussion about in recent years is animal protein sources versus plant protein sources. Not all protein is exactly created equal.
Mm-hmm.
And there are some differences in terms of how the body digests protein from different food sources, particularly with meats and animal proteins. First of all, those foods are just a lot more dense in
Yep.
protein than plant proteins are. So, if you eat 3 ounces of meat, that's about the size of my palm or a deck of cards, that's going to have around 25 grams of protein in it. If you eat a half cup of beans or lentils, that's going to be more like 8 or 9 grams of protein. So just comparing similar portion sizes, animal proteins are a lot more dense, and you can, easily eat larger quantities of those. But looking at what happens when your body digests protein, animal proteins can tend to produce more waste products
Mm-hmm.
and toxic waste products that the kidneys have to filter, specifically with things like red meats and processed meats. When the body digests those foods, it creates production of more acids that the kidneys have to filter, as well as some other harmful compounds, such as one called TMAO, that has been associated with some negative health effects. And that's essentially creating more work for the kidneys, creating greater potential for damage to the kidneys. Now, you don't have to avoid those types of foods. I'm definitely not saying that everyone has to be vegetarian or
Yeah.
vegan, but because we have a recognition that there is this difference in how these foods are broken down by the body and then handled by the kidneys, just looking at what happens when you eat these foods, those higher protein, more protein dense foods that create more waste products, they just create a little bit more work on the kidneys because that's what the kidneys do. They're filtering out waste products. And one of the primary things they do is filter out waste products from our food that we eat that ends up becoming metabolized. Plant proteins, on the other hand, like I said, they're less protein dense.
Hmm.
And they also, oftentimes, plant proteins are going to contain some other nutrients, compounds, things like fiber that can affect how they're digested and overall create a little bit less burden on the kidneys and the body as a whole. In terms of numbers, what is recommended generally? There's been some different recommendations in
Yeah.
recent years for kidney health. Generally speaking, for the average person, what is recommended is 0.8 to zero point 0.1 grams of protein per day per kilogram of body weight. If you only have one kidney, there's really no specific
Yeah.
recommendation out there. We have recommendations for kidney disease, not for just a single kidney, which is, frustrating. It'd be nice to have more
Yeah.
clear guidelines, but there's a lot of, nuance with different situations. I think that number can be kind of more on the low side to support
Yeah.
what a lot of people actually need. And what I'm finding in working with my patients who either have kidney disease or one kidney is that if we are shifting to more plant proteins, we're able to get away with more protein than
Mm.
is like technically recommended in the guidelines. And people are still seeing good outcomes in terms of how they feel, lab results, and still able to feel healthy, support their goals, especially people like you that are working out and doing exercise. You want to make sure that you're getting enough nutrition to support that. And a 0.8 grams of protein per kilogram is like a very small amount
Yeah.
in many cases for a lot of people. That's not quite going to get what you need.
Yeah, I think too, what I've noticed is that a lot of doctors who may not be so well versed in nutrition treat that as the ceiling and not maybe the floor. And I think that
Mm-hmm.
maybe can be where there's some, not on your part, because it's not your necessarily your job because you're not the USDA, but there needs to be some higher up clarification that, hey, like, first of all, this is based on people who are not active with two kidneys. And also this is a floor, not a ceiling, because you're right, your body needs protein. And for a lot of people, zero point 0.8 per kilogram is really not a lot.
Mm-hmm.
Um, but speaking about intakes and misconceptions on intakes, another one that I keep hearing that I don't have any really guidance for my clients on just because I drink copious amounts of it is coffee, which I'm drinking right now. So I would love for you, because I never really got an answer on this from anyone about how
Mm-hmm.
much coffee you should be drinking. But I know in support groups, I often see that question of how much coffee can I be drinking? So I would love for you to answer that for our listeners.
That is a great question. That's one that I hear a lot too. So I think that the reason why this question comes up is because when we think about coffee, we think about caffeine,
Hmm.
and wonder like, is that going to affect my blood vessels or my blood pressure? And this is another one of those things that's kind of individualized to you. Um, if you notice that you are somebody who drinks coffee and it causes your blood pressure to go up because of the caffeine, okay, that you might be somebody who's a little more sensitive to that.
Yeah.
People who are regular coffee drinkers that regularly have one, two, three, several cups per day, oftentimes kind of get used to the caffeine and it doesn't necessarily have that effect. It's not really going to impact them. And also, coffee is known to have kind of a diuretic effect sometimes.
Yeah.
For people who are regular coffee drinkers, we don't see that effect as much. If somebody is not a coffee drinker and they, all of a sudden have 4 cups in one day, that might act as more of a diuretic. It could have more potential to affect blood pressure just because their body's not used to the
Yeah.
caffeine. But if you're, a regular coffee drinker, you enjoy it, it's probably not really having that diuretic effect. It's probably okay for you to use. We do even have, there was a study that I think I'll have to look for it. I don't remember exactly when it came out, but I think within the last couple of years that looked at people with reduced kidney function and beneficial effects of drinking up to 4 cups of coffee per day because
Oh,
of some of the like antioxidant compounds in coffee. So that was one that I was excited to read because I'm sure there's a lot of people that are
yeah.
like 4 cups of coffee a day, sign me up. Like I'm down for
Yeah.
that. So I'll have to find the study and I can send it to you afterwards if anyone wants to take a look at that. The other thing to know about coffee is that it's sometimes not just the caffeine in the coffee, but like what you are putting in the coffee that can be the issue.
Yeah.
So if you are drinking coffee drinks that are very, sugary, very high calorie drinks, those are not going to be the best things for health because we know that for general health, consuming huge amounts of sugar is not beneficial for us. So we just want to be mindful of what you are putting into your coffee drink. But generally speaking, I don't really restrict coffee for any of my patients except for maybe some very specific situations with certain types of kidney disease where there's been studies done on coffee. But broadly speaking, most people I should probably feel comfortable consuming it. Always check with your doctor if you're not sure.
Of course.
But but yeah, generally speaking, I give most of my patients the go ahead with coffee.
I love hearing that. I personally drink black coffee, but I also like to lie and tell myself that's the way I get water. I mean, I'm a huge water drinker, so it's not like I have a problem with drinking water. But the way I think about it is like it's actually, I think it was a statistic I saw that was anywhere between I think 96 and 98% water. So it's like, look, I'm getting
Mhm.
hydrated at the same time. So
Yes,
there you
you
go.
are. You are. It does count towards part of your hydration for the day. That's another question that I get is like if coffee is kind of dehydrating or a diuretic, does it count as part of my daily water intake? And it does. And like I said, if you're a regular coffee drinker, your body's probably used to it and it's probably not
Yeah.
having as much of that diuretic effect. So it does count. So
Oh,
you're on the
well,
right track with that.
yeah. Well, thank you for clarifying that. What are some other other than like sodium, protein, and coffee, like what are some other common questions that you get from people who come to you for services and trying just to get their diet right?
I think one of the other big things that comes up for me, again, if you're Googling kidney nutrition, I've mentioned this at the top, but some of the common things that you'll find are these lists of foods to avoid,
Hmm.
in particular, high potassium foods, things like bananas, potatoes, tomatoes, avocado. And if you see this list of foods and you start thinking, oh, these are bad for me, then I think the instinct in many cases is for people to completely cut those foods out
Yeah.
because you're not sure like how much is safe. So this potassium thing, that is one of the biggest kidney nutrition myths. I talk about this all the time. If anyone follows me on social media, I talk about potassium all the time because there's huge myth and misconception about it. So first of all, what the kidney nutrition guidelines say, and again, this is for people who have kidney disease, which means that they have a GFR of less than 60 for more than 3 months in a row. They have actually been diagnosed with reduced kidney function. But what these guidelines say is that we can adjust dietary potassium intake based on your labs. So if your labs are normal, your potassium level is normal, and this again goes back to being able to read and understand your labs, then there's no reason to avoid or restrict those types of foods. Your kidneys doing what it needs to do. It's helping to maintain the right level. There's no benefit to restricting potassium just in case or like as a way to try to prevent it from becoming out of range later. There's no valid reason for that. There's no evidence that that's beneficial in any way. The other thing to know is that even if somebody does have high potassium levels, there are a lot of things that have nothing to do with food that can affect your potassium levels.
Hmm.
And this is the other thing that the kidney nutrition guidelines say is that if somebody does have elevated potassium or low potassium, we want to explore all these other non-food causes first before just starting to cut things out of the diet.
Yeah.
Some of the common things that can affect potassium that have nothing to do with food are certain medications. Blood pressure medications being a primary one. That's very common type of medication for people to be on, like lisinopril, for example, very common blood pressure medication. Certain post-transplant medications.
Mhm.
There's a whole long list basically of different medications, but blood pressure meds are probably the most common one that I run into. Another thing that can affect potassium levels in the blood is constipation. And
Oh,
this is interesting because essentially what happens if you are constipated and you have reduced kidney function, your body's mechanism of getting rid of potassium can shift a little bit more to eliminating potassium through the stool versus through the urine
huh.
if kidney function is reduced. And if you're constipated and that stool with the potassium is just sitting in your intestines, that potassium can actually get resorbed from the stool back into your system. So instead of your body eliminating that potassium via a bowel movement like it was trying to do, it can just get resorbed back into your system and cause potassium levels to be elevated again, which I think is one of the craziest things. Um, so that's something that I run into a lot because a lot of my patients are on a lot of medications, and what can happen when you're on a lot of medications, you can get constipated oftentimes.
Yes. Yeah.
So so that's something that I run into pretty frequently. So those are probably the two primary causes. There's a whole long list of other things that can affect potassium levels, but important thing for people to know, if your blood levels are normal, there is no reason to restrict potassium. If your blood levels of potassium are high, you want to talk with your healthcare team and ideally with a renal dietitian to try to figure out what is causing those levels to be high and how can you make sure that you are comfortably still incorporating some potassium into your diet. Um, Another interesting thing about potassium that I think is very important to know is that potassium is actually helpful for controlling blood pressure. So
Oh,
we think about salt a lot and how eating too much salt can maybe cause blood pressure to go up. Potassium works opposite of salt and it can tend to lower blood pressure. So oftentimes we focus a lot on this salt, but the thing that we don't necessarily focus on as much is making sure we're getting enough potassium and eating enough fruits, vegetables, beans, nuts, these good potassium rich foods. So, broadly speaking, for kidney health, in many cases, we do not want to restrict potassium. It's actually beneficial to make sure you're getting enough potassium in most cases. And that's going to look like approximately 3,500 milligrams per day or more. Again, for an individual, it's going to vary exactly how much is right for you. But getting more of those potassium rich foods is going to be beneficial for keeping blood pressure controlled. So, kind of the opposite of what you might think when you first go searching kidney nutrition and see the list of foods to avoid. In many cases, you want to keep eating those foods and make sure you're
yeah.
getting enough.
Yeah, when you were listing the foods, I'm like that other than potatoes, because I'm not a big potato eater. Um,
Mm-hmm.
but when you were listening, I'm like, wow, my if that were the case, then I could not eat like 90% of my diet. It was just like, okay,
Mm-hmm.
what am I gonna eat? Nothing. But why do you
Mm-hmm.
think these myths persist? Why with the research that's coming out and with the knowledge that's out there and people like you sharing this information, they still for
Mm-hmm.
some reason continue to persist. So I'd love to get your take on as to why.
Yeah, there's a lot of different reasons. It I think first of all, it takes a long time for uh, scientific recommendations and research to catch up into what we actually recommend in practice. Also, like we've talked about before, a lot of times it's hard to look at research sometimes and interpret it broadly to different groups of people because research is sometimes like focused on a very narrow group of people and it's hard to take that and interpret it to broader groups. So I think sometimes as healthcare providers, we might be hesitant to, even though we have new recommendations, to shift and put those new recommendations into practice because
Mm,
we've been doing things a certain way for a long time. And we might feel anxious about causing harm to a patient if we're all of a sudden recommending to do something different. Like in this case of potassium, if everyone's in the habit of recommending low potassium, keeping the levels controlled, it can feel really weird to all of us and saying, actually, you probably need more. Because if somebody does have high potassium levels, like very, very elevated blood potassium, that's a problem. That can
yes,
cause
yeah.
that can affect heart rhythm. very, very dangerous. So I think that that's kind of like with that potassium in particular, like that's the concern. Like nobody wants to cause a heart attack for a patient because they're all of a sudden adding all this potassium. Um, so I think part of it is just kind of wrapping our minds around something that's new and different from what we recommended before. Um, there's also, as far as physicians go, not really a requirement for doctors to stay up on the current nutrition guidelines. If anything, your doctor has probably had one nutrition class in school. And I mean, this is not the fault of your doctor. It's just
Yeah, of course.
education in this area needs to be broader. I feel that there should be probably some level of continuing education regarding nutrition that's required for physicians. There's not, that I'm aware of. And then also recognizing that, you know, physicians don't have to be the experts in nutrition, because there's people like me that studied it in school, did an internship, passed a board exam, and this is what I do. And I think there's not enough physicians that are referring to dietitians
Yeah.
who know what they're talking about. So within like the healthcare side, that's part of it. The whole other side of the issue is just there's lots of information on the internet. A lot of people kind of have informed, they're already kind of informed their own opinions on certain
Yeah.
things and are hesitant to do things a different way, same as us healthcare providers. There's a lot of bad information online. There's a lot of influencers who don't necessarily have any kind of credentials, that have loud voices and,
Hmm.
you know, speak very confidently and passionately, and that leads people to think that, wow, they really know what they're talking about. So there's a lot of different things that lead to the confusion and people not really knowing what guidance to follow. But you know, realistically, like some of this stuff that you'll find online, like limit the potassium foods and have a very low protein diet and avoid beans and nuts and seeds. A lot of that is like from the kidney nutrition guidelines from over 20 years ago at this point
Wow.
in time. That's a long time. We've had a lot of new research come out since then. And
Yeah.
ultimately, like we talked about, because research can be flawed, each person does need to kind of figure out what works best for them. And I think
Hmm.
that the safest way to do that is by working with a dietitian that can help you figure out how can we adjust your diet and make sure that you are still getting all of the different nutrients that you need. My fear when people start to cut back or cut out certain things by themselves is that they're maybe inadvertently missing out on some other nutrients that they do need. So working with a nutrition professional is going to be the best way to try to make sure that you are doing it as healthy as possible and figuring out what's ultimately the right nutrition plan for you.
Yeah, going back to the influencers, I was just thinking when you said that, I'm like, the number of influencers out there who are telling you most of the food you're eating is going to cause cancer is probably
I
just
know.
couldn't, could not, I think infinity is probably the right number for that. But
Mm-hmm.
you had touched on the healthcare system and what we can do. And I wanted to actually ask that question, like on the healthcare side, how can providers better combat these myths? And I think one point that you brought up is like the referring. So how can, I guess, more of a holistic look at care help combat these myths and get people on the right plans that they need for themselves?
Mm-hmm. I think we do need to recognize that, you know, healthcare providers are also humans, and we can also fall prey to things that we see on social media that influencers are talking about. So we need to be careful and, you know, what you know, doing, you know, making sure we're following um guidelines, not just, you know, hearing some influencer talking about seed oils and all of a sudden that means that we're telling our patients to stop eating those things, you
Yeah.
know. So we need to make sure that we are doing our jobs to look at the research, make sure that we're sharing the most accurate information that we know to be true. I think also as healthcare providers, um, probably one of the best approaches to take is trying to be more of a like a moderation approach versus being so black and white about nutrition. I think that a lot of times, you know, when we as healthcare providers give a recommendation to someone to, you know, limit salt or limit sugar or limit meat or limit this type of food, sometimes the way that that is interpreted by a patient is completely avoid that food.
Yeah.
So we as healthcare providers have to realize that there's there's power in the words that we use, and we have to be clear and be nuanced in the information that we share. And oftentimes the best way is to kind of be, take a moderation approach to your health and nutrition. Don't be, don't be overly restrictive on certain types of foods. I always say, it's not healthy to eat ice cream and nothing else all day long, but it's also
Yeah.
not healthy to eat broccoli and nothing else all day long, right? Like you need to have balance. And I know balance and moderation is like not the most exciting thing when you have like shirtless guys in the grocery store yelling about seed oils and different ingredients to avoid. Like it's not quite as like attention grabby to say balance and moderation. But I really think that that's in many cases the responsible thing for us to do as healthcare providers, is to help people be less afraid of foods,
Yeah.
because there's a lot of, there's a lot of people out there that are making us feel afraid of
Mhm.
foods and how they're going to affect our health. And as healthcare providers, we should be the voice of reason in those situations.
Yeah, and I'd say when it comes to like renal health, there is a lot of food fear because of those
Mm-hmm.
guidelines, in addition to those influencers who are telling you don't eat half of these things. Although,
Mm-hmm.
to be fair, a lot of those influencers are not being honest about their own diets and what they're
That's
taking
true.
to help them. So that I just separately as a coach, that's one thing that always frustrates me when I see influencers who are clearly maybe using performance enhancing drugs say, hey, seed oils, don't eat that, don't have that cake, sacrifice. And it's like, okay, we need to talk. But that's a side note, and I won't get on that soapbox. But
Mm-hmm.
it brings you, it goes back to that point of food fear.
Mm-hmm.
When you have all these guidelines saying basically, um, you should avoid everything just so you can keep your kidney
Mm-hmm.
healthy. It's like you're stuck in this place where you're actually probably making yourself sicker in a lot of ways because
Yes.
you're avoiding. And so, can you talk a little bit more about that, like the ways in which avoiding foods that you need just because you think it might help your kidney actually might hurt it more?
Yeah, absolutely. So, like I mentioned before, with like protein, for example, your body needs protein. And if you are not getting what you need, that can be a very, very serious problem. If you are avoiding certain nutrients like potassium, for example, if you're trying to avoid that list of foods that are high in potassium, not only are you avoiding the potassium, but you are inadvertently also missing out on a lot of foods that have a lot of fiber,
Hmm.
a lot of antioxidants, a lot of magnesium and zinc and other vitamins and minerals that you need. And ultimately, if you're being really restrictive on the foods that you're eating, you are probably overall going to be getting less calories than you need. And if you're, if somebody is like under eating and only getting maybe, 800 or 1,000 calories a day because they're
Mm.
afraid to eat, there's no way you can get all the nutrients that you need in a diet that is so low in energy. So that's really what the risk is that when you're cutting out certain types of foods for, a specific reason, not only are you avoiding that particular nutrient like potassium that you're trying to avoid, you're missing out on a lot of other stuff that you need. And that's one of the big reasons why there's starting to be more of a shift with potassium in particular. There's
Hmm.
even some studies that are like, have we actually been hurting people by telling them to restrict this nutrient in the past? So that's my concern. And that's why my approach with nutrition oftentimes is I'm not telling my patients in many cases to cut back things.
Hmm.
Oftentimes I'm looking at things to add back into my patient's diet, making sure like, hey, you are not getting enough potassium right now. You're actually not getting enough sodium. Like where can we add something back into your diet? Which I think is always great to start to feel that little more sense of
Yep.
freedom that you can incorporate more foods and you can enjoy what you eat. My goal as a dietitian is always to help people find that place where you're doing what's right for your health, but you're also still enjoying what you eat and living your life. Because I'm a really big believer in enjoying those like social, emotional aspects of food and eating. I think that's so important. And we don't want to be overly focused and restrictive on nutrition and fearful of food to the point that it starts to affect those other elements of food and eating that we enjoy.
And how do you help clients, other than like finding ways to bring food back in? How do you help clients who may be afraid to bring those foods back in? Because I'm sure that you've experienced, or I'm assuming that you may have had clients who were like spent so long avoiding certain foods or
Mm-hmm.
restricting certain foods that when they come to you and you're approaching them with, well, let's start adding them back in, there might be some resistance. So how do
Mm-hmm.
you navigate that resistance when you're working with a client?
Yeah, that's a good question. So going back to this potassium example, just because that's one of the ones that
Yeah.
I see the most frequently, what I like to do is actually try to look at the numbers, figure out, okay, you've been restricting potassium, and right now you're only eating 2,000 milligrams per day. Realistically, you could probably double that, but I'm not going to tell someone all of a sudden start doubling what you're eating.
Yeah.
So I might say, okay, you're eating 2,000 right now. How do you feel about increasing that to 2,500 and maybe finding an extra 500 milligrams of potassium that we can add somewhere in your day? That might be like one medium-sized banana is about 450 milligrams of potassium. And maybe somebody is afraid of eating a whole banana. So, okay, maybe we'll start with half. So I like to start with kind of small incremental steps, maybe picking a specific food that we're going to try to reintroduce, still keeping a restriction on potassium, but broadening it and working towards that eventual goal. Because I don't think it makes sense to go from, someone who's been avoiding those foods to me saying, hey, you can eat all those foods, eat as much as you want. Like it can probably feel overwhelming and you might
Yeah.
not be sure where to start. So looking at the numbers and trying to pick maybe a particular food or two to try to be the ones to focus on to introduce. And oftentimes it's somebody's favorite food that we start to reincorporate first. Like potatoes, even if you don't like potatoes, a lot of people are very, very excited when
Yes.
I say, yeah, you
Yeah.
can actually have like, let's add half a baked potato,
Yeah.
for dinner. That brings so much joy for a lot of people to be able to reintroduce foods like that.
Yeah, I don't know. I think I grew up eating like my mom and my mom's made a lot of potatoes growing up. So I think like,
Mm-hmm.
just as an adult, I'm like, I can't get rid of bread though. Like bread is still a thing. I'm like, I will find a way to eat bread no matter what. But potatoes, I'm like, it's okay. It's a potato. But I think that's great though. I think it's great to take this like moderation approach and like this incremental approach because you're right. It can be overwhelming to go kind of from 0 to 100,
Mm-hmm.
and not have like structure around it because then you run the
Yes.
risk of like, well, then, you have, because I was good. And one of the things I was going to say, the other thing that I see often in support groups is whenever the diet question comes up, it's like, well, my doctor said not to restrict anything, so I still eat the same way that I did before. And it's like,
Mm-hmm.
that might be good at going back to your point about things being individualized. It's like, that might be good for you and your body, but that
Mm-hmm.
actually might be also really bad advice for someone who's asking for it.
Totally. Mm-hmm.
So
Mm-hmm.
we have a few minutes left. So before we go, I wanted two things. One, what are your top three pieces of advice for people who have maybe either they're 20 years into survivorship and they still need to get they're trying to get a handle on their nutrition, or they just had a nephrectomy and they're trying to figure out life after. What would be your three pieces of advice when it comes to renal diet? So that's one question.
Mm-hmm.
And the other one is, please tell people where they can find you.
Yes. Okay. So three pieces of advice. First piece of advice, stay hydrated. Make sure you are staying well hydrated. Before we even get to the food, in a lot of cases, I want to make sure that my patients are staying well hydrated. We talked about, the kidneys have a bunch of blood vessels. We want to make sure that that blood is, flushing through the kidneys and the kidney is able to eliminate the waste the way that it needs to. So top priority, making sure that you are getting enough to drink. And that is also something that can be a little individualized about how
Yeah.
much. But just as kind of like a starting point, the Institutes of Medicine recommend about 9 cups per day for women, 13 cups per day for men. But individualized based on you, activity level, climate where you live, so forth. Another top piece of nutrition advice. This is going to sound very generic coming from a dietitian, but make sure you are eating fruits and vegetables. A lot of us are lacking in those areas, and those foods are so important for just total health. They provide fiber, which fiber is actually beneficial for kidney health because we are seeing more of a link between the gut and kidney health. That's like a whole other topic we could talk about sometime.
Yes. Yeah.
But that's important for blood pressure, blood sugar. It's helping to keep blood lipids well controlled. And all of these different things, blood sugar, blood pressure, lipids, those are all things that can affect the blood vessels And blood vessels, again, if you're thinking about kidney, think blood vessels. So fruits and vegetables are known to be part of a more heart healthy, cardiovascular friendly diet, hugely important to kidney health as well. And generally, if you're reading things online that say to be limiting fruits and vegetables for kidney health, like that is
Yeah.
outdated, it's off base. That's really not the way to be approaching it. And then my third tip would be to see a dietitian. There's myself and many other renal dietitians out there. This is what we do. This is what we specialize in. I spend all day, every day talking to people about kidney nutrition and helping people better understand the right plan for them because it can be very individualized. There's a lot of, you know, groups online and support groups, like you
Yep.
said. There's a lot of Facebook groups where people might kind of give well-meaning information or say, like, my doctor told me I didn't need to restrict anything, or my doctor told me I should be on this specific
Yep.
diet. And what people fail to realize sometimes is, like you said, what's right for them might not be right for somebody else and could inadvertently cause harm to someone else. So the best way to determine what is best for you is working with a nutrition professional who can look at your labs, your medications, your situation. And, no matter where you are, like you said, if you're a 20-year survivor or just had a nephrectomy, almost all of us have some things with nutrition that we could
Yeah.
probably improve on. So even if you don't feel like you have a pressing issue and you just want to check in and make sure that you're kind of on the right track, it can give a lot of peace of mind to meet with a dietitian. And if you're looking for someone who specializes in kidney health nutrition, the National Kidney Foundation has a database of renal dietitians on their website. It's kidney.org/CKDRD. And you can find either local options or telehealth dietitians. And if anyone is looking to work with me or get in touch with me specifically, again, my name is Kate Zalewski. My website is yourkidneydietitian.com. I'm also on Instagram and TikTok as Your Kidney Dietitian. I live in Chicago, but I see patients virtually over telehealth in many different states. I'm in network with a few different insurance companies and getting in network with some additional companies. And little known fact is that a lot of insurance companies will cover nutrition counseling at no cost, which is awesome. So you can check with your insurance provider and see if that's a covered benefit for you.
That's great to know. I actually did not know that. I think there's so many things that are kind of considered specialized that may not be covered, but
Yeah.
knowing that it can be covered, I think that's going to be,
Mm-hmm.
that's great to know. I think a lot of my listeners are going to be grateful to know that too. But thank you again so much for joining me and talking about this topic that you are so passionate about. And I just love just hearing everything that you have to say and the education that you provide. And yes, we will have to one day talk about gut health and kidneys because I think that's an emerging area for a lot. Gut health is emerging in a lot of areas. So it'd be
Mm-hmm.
good to
Mm-hmm.
have that conversation. But thank you so much again. I hope you enjoyed the conversation.
Yeah, thank you so much for having me. I think that this is such an important thing to talk about. Obviously, I love talking
Yep.
about kidneys and nutrition, but I think it's just it's an area where there's so much mystery or lack of
Yep.
understanding. There is a lot of confusing information, and I always appreciate any opportunity to set the record straight on some of the confusion out there, and hopefully help you, anyone who's listening, feel a little bit more of a sigh of relief about what you're doing right now, or feel a little bit more confident that you don't have to be maybe quite as restrictive as you thought you had to be.